Just OBGYN with Henry Ford Health and Henry Ford Jackson, Dr. John Paul Imperial. Welcome to the show.
Hey, thanks, Bart. Thanks for having me on.
Yeah, nice to have you here. And what's really cool is you're from Jackson, and you're here in Jackson.
Yes, absolutely. So, born and raised here. So I was born at Foot Hospital back when it was still called Foot Hospital. So very much local boy here. Went through the Catholic school systems and everything like that. Graduated from Lumen Christi, go Titans. And yeah, so it's very nice to just be back here in the Jackson area and able to provide my services for the people here who really need it. So very excited to be back.
Awesome. Well, you know, it's really great because you are practicing a specialty that is in super high demand, and particularly here in Jackson. So you could have gone anywhere because it's a specialty in demand everywhere. But why did you decide you wanted to practice in your hometown?
Yeah, so a lot of reasons. So, I mean, probably the most important reason to me personally anyway is that my wife and I, we have 4 small kids. Our oldest is 6, so we have a 6-year-old, a 4-year-old, a 3-year-old, and a 1.5-year-old. And by the time I was done with all my medical training and everything, we thought it was time to come back home to our village and everything. So came back home here to Jackson for their reasons, but also just from what I've heard, you know, from people over the last couple of years and everything. Like you said, there's been a huge need for OBGYNs here in the Jackson area. Whether people have been leaving for other ventures or passing away, unfortunately, there's been, you know, a lot of turnover in OBGYNs here. So I thought that, you know, the timing of me finishing my training with our timing right now for our family, I thought it just made perfect sense for us to come back here. So it's good for us as well as good for the community here for me to help fill that need that's been, you know, so desperate for so long.
Well, I'm glad you did. And as I always discover when I go somewhere else, life's always better here in Jackson. And it really is. You know, I've just returned from Dublin, awesome place, beautiful city, beautiful country. But life it's pretty easy, particularly raising a family right here in Jackson.
Yeah, absolutely. Definitely growing up in high school and everything, everyone just wants to get the heck out of Jackson, like see the rest of the world and everything, but people always end up coming back here for sure. So.
Well, when my kids were born, we only had 4 OBGYNs in Jackson, and it was competition. People had a tough time getting appointments and getting seen and getting the care. And it's really an area in this community, infant and maternal health. We also haven't had the greatest statistics. We've had some struggles with that, and a lot of experts are saying, well, it's the access to care, so obviously it has a lot of bearing on the community's health.
Yeah, absolutely. So access to care has been a big issue here for the last decade or so. I mean, even just me starting in the last month and a half or so, they kind of eased me in, but I'm already booked out for the next couple months here for appointments. Obviously, we'll make room for you know, people that need to be seen emergently. But yeah, just even from my first month and a half here, I've already seen that my specialty is very much highly in demand here.
Well, I'm glad you chose this specialty, but I understand this wasn't where you were first headed when you were in medical school.
Yeah, so I actually initially wanted to do some other kind of like surgical subspecialty. I was thinking kind of general surgery from the start. My older brother, he was a surgical assist surgical assist over at Henry Ford Jackson right now. And like when he was doing his training, he was talking to me about all these cool surgeries he was doing. So I knew I wanted to do something surgical related. I wasn't really thinking OBGYN when I went into medical school. But during my clinical rotations, it was a lot more surgically minded than I thought it was going to be. And then when you have the intersection of like having those like cool surgeries that are kind of focused in that specific area, in addition to being able to provide good obstetric care and being with women during these really cool moments in their lives and everything where they're giving birth, as well as just being an advocate for them throughout their whole reproductive years and everything, all those things together really meshed well with what I wanted in terms of a career. So even though I wasn't thinking about going into it when I started, that's what I ended up doing by the time I finished. So. Well,
there is some surgery in your specialty.
Absolutely. Yeah, so there's a lot of different kinds of surgeries that we do. So me in particular, I have a big interest in minimally invasive or robotic surgeries. Things that people will come in for requiring surgery can be, you know, heavy menstrual bleeding, painful menstrual bleeding, chronic pelvic pain. Those are really the big things I kind of bring people in that will often necessitate surgical management of it. And like I said, I have a huge passion for doing things minimally invasive, which just leads to a lot better patient outcomes in terms of like pain, bleeding, complications, and whatnot afterwards. So.
Yeah, and recovery, it's the big thing.
Yes, absolutely. So a big thing with that, like you said, is recovery. So we can do full hysterectomies and everything in the same day outpatient procedure instead of having to stay in the hospital for 2 to 3 days like the olden days. So
Now, I've seen the giant Da Vinci robotic surgery suites at the hospital. Do you use those?
yes, definitely. So definitely want to be building my robotic practice with it as well. So honestly, it's really good for both the surgeon as well as the patient. So in terms of ergonomics for the surgeon, you can do bigger, more complex cases just with, ease on the body and everything doing that. But also for the patients, it speeds up operative times. It leads to lower blood losses and everything, and obviously lower risk of any other complications with it because you have such better visualization with it. So it's a really cool surgical system that we use, and I love using it.
Yeah, it's amazing. Now, you've got, you mentioned a couple, but what types of conditions are you able to deal with surgically?
Yeah, so like I said, the big things that bring people into the office are, abnormal bleeding, pelvic pain, painful periods and things like that. Those are usually the big things that bring people in. Sometimes if there's some semblance of infertility and imaging shows that there's something that's like structural that's interfering with that, like a polyp or something, or possibly endometriosis or things like that, those are also things that we can resect surgically and obviously lead to improved outcomes after that.
So people that are pregnant, obviously that would be, I think about OBGYN, I mean, you're the guy. But it's not just pregnant women. There's any woman that is in need of health care, an OBGYN is her physician.
Yes, absolutely. So we also provide, primary care services as well. Obviously, women are free to, pursue primary care with, internal medicine doctors, family medicine doctors as well. But we do also provide, kind of based on primary care as well. So we offer, cervical cancer screening. We offer mammograms and everything that for breast cancer screening. In addition to taking care of them when they're pregnant or when they have other non-pregnant gynecologic issues that come in. So we're kind of a one-stop shop for a lot of those other issues as well.
And I think we just finished Breast Cancer Awareness Month, and getting screened. That's the key. Early detection can be a lifesaver, right?
Absolutely. Yeah, so very much encourage women to keep their annual appointments and everything and be up to date on the cervical cancer screening, breast cancer screening, everything like that. Because like you said, if you detect things early, oftentimes it's a small procedure to be over and done with it. And, unfortunately, I've had to diagnose people who have had lapses in coverage, and they come in and it's a little bit more serious at that point. So definitely urge people to come in for their routine wellness screenings as well.
And you deliver babies.
Absolutely, and deliver babies too. So that's also a huge blessing. Honestly, to be a part of that also. I mean, it's not very often that a patient goes into their doctor excited to see their doctor, So I have the blessing of people able to come in and just be excited to see me. It's such a happy part of their lives and everything.
How many people don't want to know the sex of their baby?
Honestly, I feel like most people do.
Really?
And there's actually some really cool non-invasive genetic testing that we do. So it's just a blood draw, and you're able to see what the gender is pretty early on in pregnancy, about like 12 to 14 weeks on. You can know what the gender is. And I would say most people actually opt for that. Maybe about like 5-10% don't want to know. But
have any of your patients named their newborn John Paul?
Not yet, but there's always room for a first one here, although it's kind of probably a 90s name or so, but maybe, who knows?
How about multiple births? Do you see a lot of those?
Yeah, so a fair amount of those for sure, especially when I did my training over at a Detroit Medical Center at Wayne State University. Saw a lot of multiple gestations and everything there, so very comfortable managing those. And I haven't had to deliver twins yet here in Jackson, but I'm sure it's coming soon.
Yeah, twins and then, triplets.
And triplets and everything more than that for sure.
It could happen. So Detroit, where else did you get medical training?
Yeah, so my whole journey, like I said, I graduated high school here in Lumen Christi. Then I went kind of all over Michigan. So I went to the University of Michigan for my undergraduate degree. Went to flip to Michigan State for my MD degree there at the College of Human Medicine. And then I went for my OBGYN residency training over in Detroit Medical Center. So kind of all over Michigan for sure.
Well, who do you cheer for in the Michigan State game?
It depends who's asking. In general, though, probably U of M, though. I'm always probably going to bleed blue.
John Paul, what do you find most gratifying about being an OBGYN in Jackson?
So I think just being able to be a part of such an intimate, tender moment between a woman and her baby at that time of delivery is such a beautiful experience, honestly. Being able to help facilitate that in a safe, calm manner and everything, just being able to bring life into this world, it's not very many people can say that they do that. So it's awesome to be able to be a part of that experience.
It's been a while since, I was being a parent. My kids are in their 40s. We had, after the baby was born, the hospital had a steak dinner for the new parents. I think you should bring that back.
I think we should too. I mean, like, people often need iron after delivery, so steak's a good source of iron. So I'm a huge advocate of that for sure.
Yeah, it was like your last moments of solitude before, and people, the baby and you're home. I mean, you kick them loose pretty quickly, don't you? After the birth.
No, absolutely. So if it's a normal delivery, usually 1 to 2 days after they're back home taking care of baby. So.
All right. Well, we're getting cold weather, fall, winter. What do you suggest? Anything, and a tip or two for women to do to stay healthy during these cold winter months?
Honestly, a lot of it just comes down to common sense, honestly. Just having good hygiene, hand hygiene, washing your hands frequently, staying away from people that you know are sick, kind of like common sense things like that. Of course, getting your flu shot whenever it's available. It's available now in most places, so just getting that's a good idea too if you haven't gotten it yet.
Awesome. And where's your office?
So my office is at Cascade Ridge, so it's on Spring Arbor Road, right next to Luma Christi, actually. So never too far from there, I guess. So full circle moment. Awesome.
Well, great to have you here. Welcome back, and thanks for coming on our show today.
Absolutely sounds good. Yeah, thanks, Bart.
You bet. From Henry Ford Jackson Women's Health, OBGYN, Dr. John Paul Imperial.